You are taking vitamin D to protect your aging bones and keep your blood pressure stable, but there is a very high probability that the specific way you are swallowing that pill is turning it into little more than expensive dust in your digestive system. I have seen patient after patient come to me with perfect supplement routines, yet they still suffer from deep fatigue, aching joints, and stubborn morning blood pressure spikes because they are missing the biological key that actually unlocks the vitamin. I am about to show you exactly why your body might be rejecting the vitamin D you are giving it, and the simple changes that can double your absorption and help regulate your blood sugar and pressure starting today. I'm Dr. Ben Harris, and today I am going to help you fix this common mistake. Here is the first major error that I see in my clinic almost every single week. 1. The naked pill mistake. This is the most common reason I see seniors failing to get the benefits of their supplements, and it usually starts with a very innocent morning habit. Let me tell you about a patient of mine named Arthur. Arthur was 72 years old, and he was precisely the kind of patient every doctor loves to have because he was incredibly disciplined about his health routine. He had a pill organizer on his kitchen counter, and every single morning at 7 o'clock, he would wake up, boil water for his black tea, and take his vitamin D supplement along with his blood pressure medication. Arthur believed he was doing everything right because he never missed a dose, not even once in 3 years. However, Arthur came to see me because he was frustrated and honestly a little scared. Despite his discipline, his blood pressure was creeping up, his joints were stiffening, and his latest blood work showed his vitamin D levels were hovering near the bottom of the range, almost as if he wasn't taking anything at all. He looked at me and said, "Dr. Ben, I am taking 5,000 units a day. How is it possible that my levels are this low?" The problem wasn't the brand of the vitamin, and it wasn't the dosage. The problem was the black tea. You see, vitamin D is what we call a fat-soluble vitamin. This means it is biochemically impossible for it to dissolve in water. When Arthur swallowed that pill with nothing but black tea, which has zero fat, the vitamin sat in his stomach like a droplet of oil in a glass of water. It could not dissolve, it could not bind to anything, and therefore it could not pass through the intestinal wall effectively to get into his bloodstream. It was simply passing right through him. For a senior body, which already has a slower digestive system and less stomach acid than a younger body, this naked delivery method means you might be absorbing as little as 10 or 15% of what is on the label. We made one simple change to Arthur's morning. I did not increase his dose. I simply told him he had to take that pill with his breakfast, specifically a breakfast that contained healthy fats. We are talking about eggs, or a slice of toast with avocado, or full-fat yogurt, or even just a small handful of walnuts. When you introduce dietary fat, it triggers your gallbladder to release bile. That bile breaks down the fat, and because the vitamin D is clinging to that fat, it gets shuttled directly across the intestinal lining and into your system where it can actually go to work, lowering inflammation and regulating your blood pressure. Arthur started taking his vitamin D with 2 scrambled eggs every morning. When we retested his blood 3 months later, his levels had doubled. He had not changed the pill, he had only changed the vehicle he used to deliver it. Now, while we are talking about Arthur and his frustration with his numbers, I want to address a critical micro-habit regarding his blood pressure, because this is where many of you are also being misled by your own readings. Arthur told me his blood pressure was erratic, sometimes jumping to 150/90 in the mornings, which was causing him immense stress. When I asked him to show me exactly how he measured it, the problem became obvious immediately. Arthur would walk into the kitchen, drink his tea, realize he forgot to measure, rush to the living room, sit down, and immediately slap the cuff on his arm and press the button. This is a recipe for a false high reading. When you move, even just walking from the kitchen to the chair, your heart rate elevates slightly to pump blood to your muscles. If you measure immediately, you are measuring that activity, not your resting pressure. I need you to follow the 5-minute rule. Sit down in a chair with back support. Place your feet flat on the floor, uncrossed. And then, this is the hard part, you must do absolutely nothing for 5 full minutes. No talking, no looking at your phone, no watching the news, just breathing. This allows your vascular system to settle down to its true baseline. When Arthur started doing this, along with fixing his vitamin D absorption, he realized his spikes were largely due to error and poor absorption. His true average was much healthier than he thought. This supports steadier readings and saves you from unnecessary panic. Before we move to the next item, I want to hear from you down below. Comment your age and your usual top number range for your blood pressure. It helps me understand who is watching so I can make these videos even more helpful for you. Now, let us move to the second major misunderstanding that puts your health at risk. 2. The solar fallacy. There is a very romantic idea that we do not need vitamins because we can just go outside and get everything we need from nature. I wish this were true for everyone, but for those of us over 60, relying solely on the sun is a mathematical error that could be keeping your blood pressure dangerously high. Let me introduce you to Martha. Martha was 68 years old and she was an avid gardener. She spent at least 2 hours outside every single morning tending to her roses and her vegetable patch. When she came to my clinic for a general checkup, she was absolutely shocked when I told her that her vitamin D levels were critically low. She argued with me. She said, "Dr. Ben, that is impossible. I am out in the sun every single day. I have a tan to prove it." Martha was making a mistake that millions of seniors make. She assumed that her skin at 68 worked exactly the same way it did when she was 20. Here is the biological reality. Our skin contains a precursor to cholesterol that reacts with UV light to create vitamin D3. However, as we age, the amount of this precursor in our skin decreases significantly. Furthermore, our skin becomes thinner and less efficient at this chemical conversion. A person over the age of 70 produces about 75% less vitamin D from the same amount of sun exposure compared to a 20-year-old. So, while Martha was getting plenty of fresh air and exercise, which is wonderful, she was not getting the hormonal support she needed to keep her arteries flexible. This is not just about bones. This is directly about your heart and your blood pressure. A very significant study released in late 2024 in the Journal of the Endocrine Society highlighted this exact connection. The researchers looked specifically at older adults. They found that vitamin D supplementation had a significant effect on lowering both systolic and diastolic blood pressure, particularly in older adults who carried a little extra weight. The study confirmed that for this demographic, the natural method of sun exposure simply wasn't generating enough active vitamin D to influence their cardiovascular health. The mechanism is fascinating. Vitamin D acts as a natural inhibitor of the renin-angiotensin system. That is a complex name for the hormone system that regulates your blood pressure and fluid balance. When vitamin D is low, this system goes into overdrive, constricting your blood vessels and forcing your blood pressure up. By relying only on the sun, Martha was leaving her renin-angiotensin system unchecked. We started Martha on a supplement routine, not to replace her gardening, but to support it. Within weeks, she reported that her energy levels were more stable, and her home blood pressure readings began to trend downward. She didn't have to give up her garden, she just had to accept that her skin needed a little bit of help. Now, a brief safety note on this. I am not telling you to go bake in the sun for hours to try to force this conversion. Excessive sun exposure brings its own risks, including skin damage and skin cancer. It is much safer and more consistent to get your vitamin D from a controlled source like a supplement or fatty fish, rather than risking a burn for a conversion process that is already inefficient. This is about working with your body's current reality, not the reality of your youth. Now, this leads us directly to a very dangerous situation where taking vitamin D can actually make you feel worse if you ignore this next connection. 3. The Lone Ranger error. This is perhaps the most critical biochemical relationship you need to understand. Vitamin D does not work alone. It has a partner, and if that partner is missing, the vitamin D you take simply piles up in your system, useless and inactive, while creating new problems for your heart rhythm and your blood pressure. I want to tell you about Robert. Robert was 74, and he started taking vitamin D because he read it was good for his immune system. He started with a high dose, about 10,000 units a day, because he believed that if some is good, more is better. 2 weeks later, Robert called my office. He said, "Dr. Ben, I don't feel right. I feel jittery. My heart feels like it's fluttering in my chest, and I'm anxious all the time. I think the vitamin is toxic." Robert wasn't experiencing vitamin D toxicity. He was experiencing a magnesium deficiency that was induced by the vitamin D. Here is what happens inside your body. The vitamin D you take in a pill is biologically inert. It is inactive. To become active and useful to your body, it has to go through a conversion process in your liver and then in your kidneys. This conversion process runs on fuel, and that fuel is magnesium. Every single molecule of vitamin D you take requires molecules of magnesium to activate it. So, when Robert started flooding his system with high-dose vitamin D, his body started frantically using up all his stored magnesium to try and process it. Robert was already low on magnesium, as many seniors are, due to soil depletion and medication use, so this extra demand drained his tank completely. Magnesium is the mineral of relaxation. It relaxes your arteries to lower blood pressure. It relaxes your muscles. It calms your nervous system. When Robert ran out of magnesium, his arteries constricted, his heart became irritable, and his anxiety spiked. The vitamin D wasn't hurting him directly, it was the robbery of his magnesium that was causing the symptoms. We stopped Robert's vitamin D for 3 days. We immediately started him on a magnesium-rich diet. We focused on pumpkin seeds, spinach, Swiss chard, and almonds. We also added a gentle magnesium glycinate supplement in the evenings. Once his magnesium levels were replenished, we reintroduced the vitamin D, but this time he felt fine. His heart palpitations stopped, and his blood pressure, which had spiked during the jittery phase, came back down. This is why you must never treat vitamin D as a lone ranger. Now, if you are ever in a situation like Robert, where you feel that sudden spike in anxiety or blood pressure, perhaps you feel that wired sensation, there is a lever you can pull immediately. This is a same-day lever that works on your nervous system instantly. It is called the 4-7-8 breathing technique. You can do this at home, right now, sitting in your chair. It works by forcing your body to switch from the sympathetic fight-or-flight mode to the parasympathetic rest and digest mode. Here is how you do it. You inhale quietly through your nose for a count of 4. 1, 2, 3, 4. Hold that breath for a count of 7. This pause allows oxygen to fill your lungs and circulate. 1, 2, 3, 4, 5, 6, 7. And then exhale forcefully through your mouth, making a whoosh sound for a count of 8. 1, 2, 3, 4, 5, 6, 7, 8. Robert used this whenever he felt that flutter, and it helped stabilize his pulse almost immediately. Most older adults can try this safely, but if you have severe lung issues, just adjust the counts to what is comfortable for you. Do not force the breath, just find a rhythm. If you are finding these patient stories helpful, please take a second to subscribe to the channel. It helps me reach more seniors who are struggling with these same confusing symptoms. Now, let's look at a mistake that ruins your blood sugar control, simply because of the time on the clock. 4. The timing trap. We often think of vitamins as something we can take whenever we remember them. Maybe you keep them on your nightstand and take them right before bed. If you are doing this, you might be inadvertently sabotaging your sleep and by extension, your fasting blood sugar numbers the next morning. Let me tell you about Sarah. Sarah was 65 and she was struggling to control her prediabetes. She was very confused because she was eating a clean dinner, low in carbohydrates, yet she would wake up with a fasting glucose of 115 or 120. She felt like her body was betraying her. When we reviewed her daily log, I noticed she took her PM meds at 9 p.m. and she included her vitamin D in that handful of pills. This was a biological signal error. Vitamin D is inversely related to melatonin. Melatonin is the hormone that tells your body it is time to sleep. Biologically, vitamin D is associated with sunshine and daytime. When you flood your system with vitamin D at 9 p.m., you are essentially sending a chemical signal to your brain that the sun is up. This suppresses your melatonin production. Sarah wasn't sleeping deeply. She was tossing and turning, even if she didn't fully wake up. When you have poor quality sleep, your body perceives it as stress. In response to stress, your adrenal glands release cortisol. Cortisol has a specific job. It tells your liver to dump stored sugar into your bloodstream to give you energy to handle the stress. So, Sarah was waking up with high blood sugar not because of what she ate, but because her liver was panic dumping sugar all night long due to the cortisol spike caused by the poor sleep caused by the nighttime vitamin D. It is a domino effect. We moved Sarah's vitamin D to breakfast time, just like we did with Arthur, but for a different reason. Within a week, she reported sleeping through the night for the first time in years. And more importantly, her morning fasting blood sugar dropped from 120 down to 105. She hadn't changed her diet. She had just respected her body's circadian rhythm. This is why reading context is so important when you look at your glucometer. If you see a high number in the morning, do not just blame your dinner. Ask yourself, how did I sleep? If the answer is badly, that high number is likely cortisol-driven, and you need to focus on sleep hygiene, not just cutting more carbs. This is a simple adjustment, but it has profound effects on how your body regulates energy. If you use insulin or glucose-lowering medication, please check your readings more frequently when you fix your sleep, because as your stress hormones drop, your blood sugar might drop more efficiently than you are used to. I want to pause here for a moment, because the next item on this list is the one I hinted at in the beginning. It is the partner nutrient that prevents your arteries from turning into stone. Without it, all the vitamin D in the world could be doing you more harm than good. We are going to discuss exactly how to prevent calcification and the specific food swap that supports it. Here is another crucial piece of the puzzle. 5. The calcification hazard. I mentioned earlier that vitamin D absorbs calcium. That is its main job. It pulls calcium out of your gut and puts it into your bloodstream. But here is the problem. Vitamin D does not tell the calcium where to go once it is in the blood. It just opens the door. Without a traffic cop to direct that calcium, it can settle in the soft tissues of your body. It can settle in your kidneys, causing stones. And most dangerously for your blood pressure, it can settle in the walls of your arteries, causing them to stiffen and harden. This is called arterial calcification. Let me tell you about James. James was 70 years old, and he had a calcium score test done on his heart. He was terrified because the score showed some buildup. He told me, "Dr. Ben, I'm stopping my vitamin D. I don't want to add more calcium to my arteries." I told James that stopping vitamin D wasn't the answer, because low vitamin D is also bad for the heart. The answer was adding the traffic cop. That traffic cop is vitamin K2. Please listen carefully to the difference. K1 is found in leafy greens and helps your blood clot. K2 is found in fermented foods and animal fats, and it activates a protein called matrix GLA. This protein acts like a claw. It grabs the calcium floating in your arteries and physically moves it into your bones and teeth where it belongs. James was taking plenty of D but zero K2, so he had calcium floating around with nowhere to go. We added a vitamin K2 supplement to his routine, specifically the MK7 form, which lasts longer in the body. We also looked at his diet to find a long-term lever to support his arterial flexibility. James ate a lot of processed deli meats and white bread, which are very high in sodium. Sodium stiffens arteries. We made a swap. We swapped his lunchtime sandwich for a large salad with sardines, which are rich in natural K2, and we swapped his side of chips for steamed asparagus. This shift lowered his sodium intake and increased his potassium. Potassium helps relax the blood vessel walls, working in harmony with the K2. Over the next year, James's blood pressure stabilized significantly. While we cannot easily erase old calcification, we can certainly stop adding to it. James felt more confident knowing he was directing the calcium to his bones, which were aching less rather than his heart. This combination of D3 and K2 is becoming the gold standard for senior heart health, and you need to ensure your supplement includes both, or that you are eating enough K2-rich foods like natto, hard cheeses, or egg yolks. One brief reminder here. If you are on a blood thinner like warfarin or Coumadin, you must speak to your doctor before adding vitamin K2, as it can affect how your medication works. Safety always comes first. Now, there is another mistake that is purely a numbers game, but if you lose it, your blood sugar pays the price. 6. The guessing game. I see so many seniors taking a standard 1,000 unit pill because that is what the multivitamin bottle says. They assume they are covered. But when it comes to insulin sensitivity and blood sugar control, average is not enough. Let me introduce you to Elena. Elena was 66 and had been struggling with type 2 diabetes for a decade. She was taking her medication, but her A1C was stuck at 7.5. She was taking 2,000 units of vitamin D a day, which sounds like a decent amount. We tested her levels, and she came back at 32 nanograms per milliliter. Now, on a standard lab report, 32 is considered sufficient. It is enough to prevent rickets. It is enough to prevent severe bone disease, but it is not optimal for blood sugar control. I explained to Elena that recent research suggests that to really impact insulin sensitivity, that is, how well your cells open the door for sugar, we often need levels closer to 50 or 60 nanograms per milliliter. There is an inverse relationship shown in studies. As vitamin D levels go up to that optimal range, insulin resistance tends to go down. Elena was in range for a bone doctor, but she was deficient for a metabolism doctor. We slowly increased her dosage, monitoring her blood work every 3 months. We aimed for a target of 55. It took us about 6 months to get there safely. As her levels climbed, something remarkable happened. She started noticing fewer blood sugar spikes after meals. Her fasting numbers started to drift down into the 90s. Her cells were finally listening to the insulin her body was producing. Elena had been guessing at her dose, assuming the standard bottle was enough, but because she carried a little extra weight, the vitamin D was getting trapped in her fat cells and not circulating in her blood. She needed a higher dose than her husband, who was thinner. You cannot guess this number. You must test. Ask your doctor for a 25-hydroxy vitamin D test. Do not settle for just being above 30. Ask if your level is optimal for your metabolic health. This simple knowledge gave Elena a new tool in her diabetes management that had nothing to do with cutting more foods out of her diet. It was about fueling her cells correctly. Now there is one final hurdle that can block everything we have just discussed, specifically for those of you battling high blood sugar right now. 7. The sugar blocker. This is a vicious cycle that you need to break. We have talked about how vitamin D helps lower blood sugar, but did you know that high blood sugar actually blocks vitamin D activation? It goes both ways. Let me tell you about David. David was 69. His diabetes was uncontrolled. His liver was constantly under stress processing excess fructose and glucose. Because the liver is the first step in activating vitamin D, his fatty liver, caused by high sugar, was sluggish. He was taking supplements, but his liver couldn't process them efficiently. It was like trying to pour premium gasoline into a car with a clogged fuel line. David felt stuck. He said, "Dr. Ben, the vitamins don't work, and the diet is too hard." We needed a same-day lever to lower his insulin spikes so his liver could catch a break and process the vitamin D. We implemented the 10-minute post-meal walk. This is not a marathon. It is not a jog. It is simply getting up from the table after breakfast and dinner and walking at a normal pace for 10 minutes. When you walk immediately after eating, your muscles suck up the glucose from your blood without needing as much insulin. This lowers the strain on the liver. David started doing this. He walked around his living room when it was raining and around the block when it was sunny. By lowering that post-meal spike, he gave his liver a chance to function better. Over time, his vitamin D levels started to rise, even though we kept the dose the same. His body was finally able to use what he was giving it. This supports steadier readings and breaks the cycle of resistance. It is a small movement that pays massive dividends. If you know someone over 50 who could benefit from this, share this video with them. It might just be the missing piece of the puzzle for their health. And subscribe for more simple blood pressure and blood sugar tips. I'm Dr. Ben Harris. I will see you in the next video.